Welcome to the Egg Whisperer Show, a podcast exclusively designed to create more reproductive health awareness and discuss your fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
Welcome to the Egg Whisperer Show. From infertility to miracles inside the world of medicine, we're going to talk to two very distinguished OBGYNs today, Dr. Sanfilippo and Dr. Andrew-Jaja. Welcome.
Thank you, Dr. Amy.
Thank you so much, Amy, Dr. Amy. Nice to meet you.
You call me Amy. What if the impossible wasn't so impossible after all? From groundbreaking fertility treatments to the most heartwarming patient stories, Dr. Sanfilippo and Andrew-Jaja share the real-life miracles that happen every day in women's health. Plus, you'll hear why Dr. Andrew-Jaja is known as the singing doctor. You won't want to miss this inspiring conversation. On today's episode of the Egg Whisperer Show, I'm honored to welcome Dr. Joseph Sanfilippo and Dr. Carey Andrew-Jaja, two distinguished experts in obstetrics and gynecology who have dedicated their careers to women's health. Dr. Sanfilippo is a tenured professor at the University of Pittsburgh School of Medicine and a past president of the American Society for Reproductive Medicine, with extensive expertise in reproductive endocrinology. Dr. Andrew-Jaja, a retired clinical professor at UPMC, McGee Women's Hospital, is widely known as the singing doctor for his heartwarming tradition of celebrating newborns with song. I think one of those songs may have gone viral not that long ago. Together, they've contributed to Everyday Medical Miracles, a collection of powerful stories from the front lines of women's healthcare. I can't wait to dive into their experiences and insights, especially in the world of fertility and reproductive medicine. Okay, you two, now I want to hear some really fun stories. How did the two of you join together to write this book?
Great question, Dr. Amy. And the way it starts is back in 1997, I was appointed chairman of the Department of Obstetrics and Gynecology at Allegheny General Hospital. This is a very large community hospital, very busy obstetrical service, gynecologic surgery, and we had a residency. So I was the chairman, and Dr. Carey Andrew-Jaja was the vice chairman. So we interacted, I would say, all day long, essentially, in some capacity, whether it's a problem with a resident versus a patient problem. And so we really kind of built a great relationship. So that dates back to 1997. And then, unfortunately, that healthcare system had some financial problems, and I moved over to the University of Pittsburgh Medical Center, UPMC. And soon after that, Dr. Andrew-Jaja joined me. And now I want to get his part of the story.
Yes, Joe has almost said it all. Yes, we've been on the same faculty for the past 26 years or more, 27, 28. And moving from Allegheny General Hospital to across the river to University of Pittsburgh Medical Center, McGee Women's Hospital, it continued. Our relationship continued. In fact, they built a suite for my patients right across from the Center for Fertility and Reproductive Endocrinology. How fortuitous that was, for me to be right across from my good friend. And I found that we continued to share patients. I sent him the most difficult infertility patients, knowing that he would tackle them well. And maybe he didn't know this, but his nurses always sent me patients who didn't have a dedicated OB-GYN that they could go back to. So it went both ways, and we got to know each other. At the social level, we got to know each other's families, attend each daughter's weddings over the years. So we've become very good friends. So you asked about this book. It was beautiful. It was in 2022 that Joe called me in 2022 and said, how about this idea of putting some stories together? And I bought it right away. Stories about patients we've taken care of over the years. Let's get a few of our colleagues and co-workers to join with us, and each person brings their story, the ones that they would never forget. And that's what we did. We put this into action, and within a couple of years, we've been able to come up with this collective book of interesting stories.
Throughout your careers, you've both witnessed advancement in women's health and fertility treatments. Looking back, what are some of the biggest breakthroughs that have turned what once seemed impossible into everyday medical miracles?
From my perspective, and I have to speak for you, Dr. Amy, we have the advent, as I like to think of, IVF, okay? And I had the privilege of being in the audience when Steptoe and Edwards presented at the American Society of Reproductive Medicine. They're incredible, and every time I think about it, just makes, I get excited about it. All of, there's incredible success with IVF. Of course, at the end of their presentation, there was a standing ovation. So where are we today? I don't know what the number is, but the last time I saw it was like 8 million IVF babies worldwide who would not be here if we did not have that technology. And always remember, IVF is there for unexplained infertility. IVF is there for a woman, and I hate the term advanced maternal age, over 35, where Down syndrome and other genetic problems have a higher chance. We can detect that. Cystic fibrosis, we can detect that in the embryo before we put it in the uterus. And the story goes on and on. So if there's one thing that, here we are 2025, that I get excited every time I see a patient who's a candidate for IVF, because it can happen. And, we used to have medicine, we used to have surgery, microsurgery, IVF trumps it all. Carey, what do you think?
Yes. Well, so for me, though, the most important development has been the training of experts, the education of experts to do the unthinkable, the unthinkable in the good way, meaning provide service that we did not think was possible. The field of infertility. And when I was a resident, finishing my residency in 1981, there was only one infertility specialist in the whole Pittsburgh area. So some of us dabbled into it. I was very interested, evaluating patients, giving clomiphene, shots of proguanol, twins following some proguanols, Anyway, all that was good. Training on tubal reanastomosis. I went to Victor Gomel a year later, in Vancouver, British Columbia, and learned how to do tubal reanastomosis, putting those two microscopically together. It was fun. For one who loves surgery as well, it was a good experience. But to do one a month was not good enough. And so to have people who dedicate the whole entire time to infertility was a phenomenal thing, and to do it well, to do several surgical procedures, if that is what is necessary, in a week of the same type, know the problems that occur and resolve them and prevent them. That, to me, that was the biggest advance. The availability of highly trained individuals like Joe Sanfilippo, like you, Dr. Amy. I'm sure when you're not doing these interviews, you're doing your best to provide a great care to your patients.
Right. And I can tell, just speaking with both of you, how well cared for your patients feel and felt over the decades that you have taken.
Yes.
Care isn't just about science. It's also deeply emotional work that we do. How have you seen the relationship between medical expertise and patient empathy make a difference in helping people navigate fertility challenges and even complicated pregnancies?
There's a story in the book written by Dr. Aya. Let's call her that. But her patient's name was Lucy in the book. All right. Lucy is a specialist herself. Dr. Aya is a PCP. It's her PCP. And Lucy shows up very, very fearful that she may never get pregnant. She had seen an infertility specialist just prior to her first visit, who told her, your uterus is like a war zone. Something that I had never heard from my colleagues that in this field. Your uterus is like a war zone because you had multiple fibroids. Your chance of getting pregnant is not high. It's very low. Well, maybe we can try. This girl was shattered by this, and she came to her PCP, and over the next year or so, she was unable to try anything new. She was afraid it wouldn't work. She was angry at the doctor. She was angry at anything that caused this fibroids. Actually, after the fact, there were not that many. There were just a few fibroids. But that was where she was, and they held hands. Dr. Aya listened to her and helped her through those phases of fear and anger, until it came to a point where she could start accepting. I mean, so maybe I'm never going to get pregnant again, But I said, yes, you can. Yes, you probably can do it. So take care of yourself first. She did holistic things to help her body and her mind feel better. They did them together at times until a point came when she was able to try again. So the emotional aspect is this ability for your primary care physician. This Dr. Aya was not an infertility specialist, but the ability to understand the emotions that this patient was going through and help her build tenacity and help her be kind to herself, help her feel empowered that she can get there. All that brought both of them joy in the end. And that is this story.
And Dr. Sanfilippo, do you have a story as well that you would like to share?
Now, in this day and age, most of what I do is via telemedicine, when we were seeing patients all the time in the office. And I'm there, and this patient comes in and says, I'm interested in IVF. Fine. Well, what happened? Well, we had two girls, and very unfortunately, my husband and a daughter were in a very major car accident, and my daughter died. That point, I just reached out and held her hand, and there had to be the silence of the, communication at that point. And now she was, again, advanced maternal age, like 39, approaching 40. Time was very important. So we said, okay, let's do IVF and so on. Well, the turnout was okay, but not spectacular, meaning there were only a few eggs. One got fertilized. We did the embryo transfer, didn't work. Did another cycle, ultimately did 3 IVF cycles. But the good news is, as we speak, she now has a son in addition to her other daughter. And it's a whole new world. Every time I think about it, my heart goes right out to this lady of what she went through. And she was so stoic in her approach to life and knew there's got to be light at the end of this tunnel. And I just hope a lot of your patients and audience perceive things of what you and I do, that there is light at the end of that tunnel. And we'll do our best to get you there. You're not alone on this journey. Your doctor is there for you, okay? And your doctor's entire team is there for you. I give most of the credit to the nurses, because they're the ones who have the patients and are on the phone and talk about hand-holding, Yeah, it's a team approach, but it's so, encouraging and rewarding that we can help people and we can help your audience, independent of what the problem is. Many, many times. We can't promise everybody, but there's hope.
Yeah. And patients often ask me, like, Dr. Amy, how can you be so hopeful for me? How can you always be so positive given everything that I've been through? And I say, because good things actually really do happen to good people. I know that you feel like everything's always gone wrong for you, but with science and love, good things can happen.
Absolutely. Totally agree. Yeah.
I'd love for you to share some lessons you've both learned about being OBGYNs and a fertility doctor that you can pass on to doctors, let's say, that are just finishing their training and starting off their careers.
One of the first things I learned that I'll pass on is that we should all feel grateful and for where we are in life. Not in any subdued way. You don't have to be mousy about it, but you don't have to brag about it either. But just internally be grateful for what you are doing and the accomplishments you're doing. It empowers you to do more. But also accept that you are not invincible. Also, that you're a human being. There's a potential you may make mistakes, either in your interactions with people or in your assessment of the situation right in front of you. So just to know those things and to know that you don't always have control of everything. Some things can happen that will thwart your best plans to go one way. It is anticipating that feeling that, yes, you may not have the control, that makes you actually a little more careful in what you do. You are resilient yourself. You wouldn't have gotten through medical school residency for infertility without being resilient. So teach that to people around you, encourage them. I like positive reinforcement more so. When I see somebody doing something good, I say, that's nice, it and reinforces that feeling that you are more resilient than you think. And how to process for what we do with our patients for infertility, of course, it is the emotions are so wide, going from fear that it may not happen to the extreme joy when it happens. Teach people to embrace all of that with kindness to themselves, realizing sometimes that this is a privilege that may not happen to everybody, but I know by God's grace, whatever you believe, or if you're not a religious person, by the strength of your being, that this will happen too. If you're a physician, give space, give grace for your patients around you to deal with their emotions with you, and all of you will get a deeper appreciation for what you do. Those are the lessons that they sound more emotional leaning. Of course, all of us, you have to keep your trade going. You every moment you should be learning new stuff. You should be learning new stuff. You never stop learning. At least that was true for me.
Those are great lessons. Thank you for sharing them. And Dr. Sanfilippo, what about you?
What I do week in and week out is spend a lot of time teaching. And now the teaching includes what we call APPs, Advanced Practice Providers. And as many of you know, these are PAs and nurse practitioners. So they'll spend like a month with me and with my colleagues, and they'll learn all about women's health. And so they walk away with a good, solid foundation, and they may not go into women's health, but they'll always be in need because they're a healthcare professional. People are always going to ask you, hey, what do you think, et cetera. The next level is the medical students, and I get particularly excited at different levels. Like the third year, they don't know what they want to go into. The fourth year, spend a month with us when they want to go into OBGYN. Well, that's a golden opportunity for us to share with them our enthusiasm for infertility. Like I'll jokingly say, well, in the middle of the night, if you're going to deliver babies, remember Dr. Sanfilippo said you could have been an infertility specialist. That just goes so far. But anyway, and they politely smile and let's move on. Anyway, moving on to the next level would be the residents. And here's a golden opportunity to share your enthusiasm, to be a role model for them. And that's so important to me. One of the stories in the book that's related to Dr. Jaja. And the story includes, everybody said, OBGYN, you don't want to do that. You're up all night. Why would you ever want to do that? And the author says, well, I guess Dr. Jaja didn't read that book because, he loves what he does. But continuing on my role, so the residents and then fellows. And again, I know your audience knows, but a fellow spends, in our case, 3 years learning how to be an infertility specialist after their medical school and after 4 years of residency, so 3 more years. And then this is the golden opportunity, because now these people will take the banner and go across the nation or wherever they're going to go and carry on. That to me is important. But to succinctly answer your question, I think we have an obligation to teach, to set the example, to be a role model, and to open doors. Like for the medical students, I'll say, yes, I'm happy to write you a letter of recommendation. I'm happy to, be an advocate for you for your residency. But let's talk about what you want to do and what's the best program, and try to have a nice fit. So, these things make a difference. But I share Dr. Andrew-Jaja's enthusiasm. It's a privilege to be a doctor. It's a real privilege. And, here I am 40 years out of medical school, and I still get Christmas cards from patients. Their son wants to become an infertility specialist. You know what I mean? I say that you can really tell you're old when a former fellow's son comes to you wanting to do a fellowship with you. But it goes on, and it's always a new learning experience. Absolutely. You never stop learning.
Yeah, we never stop learning, and it's such a privilege to take care of these families for generations. I always say I'm so lucky that I get to do something that I love so much each and every day.
Ooh.
So, this book includes stories of patients also facing complicated pregnancies. Can you share an example of a high-risk fertility or pregnancy case that resulted in a truly extraordinary outcome?
So the story that comes to mind is it was written by an author who was a second-year resident when this incident happened. She was assisting an established, experienced OB-GYN in the operating room on a repeat cesarean section. Your listeners will know that cesarean sections happen every day. There are probably too many times. Recently now, we've got it to where 3 out of 10 pregnancies end with a cesarean section. When I was a resident, it was about 5%. But it has grown in this country, especially. In some countries, worse. But cesarean sections are common, and because of that, repeat cesarean sections are now extra common. Let me use a simple word. So they were doing a repeat cesarean section, something that she had done 100 of them by then, or more, maybe 200. And they get in there, they make the usual incision, they prepared actually, she saw the patient beforehand. Saw the patient, they had obtained an informed consent from the procedure. Anesthesia saw her as usual. They brought her back into the operating room, prepped her belly, and came in very nicely, hoping expecting another day at work to go smoothly. Now they made the skin incision, went through the layers, and got in there. Something didn't feel quite right. They thought they were getting into the wall of the uterus, but it was thinner than usual. Yet they made the incision and got in there, retrieved the baby, clamped the cord, handed over the baby, crying nicely, to the pediatrician, to neonatologists who were there. Anyway, they felt again, something was wrong. Where is the placenta? The placenta was not in a chamber like they had expected. It was a little remote from where they were working. According to her, she said, my attending physician must know what he's doing here now, because she didn't know. But even the attending was baffled by what was going on. They felt around. They could not retrieve the placenta. They felt around, were able to explore the area, and found what looked like a normal uterus, slightly bigger than usual, in one corner of the pelvis to the side. So all along, this is like Houdini, not growing in the room, but this baby had escaped and grown outside the uterus.
Wow.
This baby this is an abdominal pregnancy. Rare, but it's a very, very serious condition. To me, it brings to mind a lot of things, because you wonder, cesarean section has something to do with it? Maybe yes. If I gave away everything that they did, I think I'll be giving away too much. Did this patient make it or not? Again, this is the suspense. Oh, the reader has to discover for themselves what happened afterwards. But it is a serious condition, this abdominal pregnancy. How to reduce the chance of it happening if it was related to a cesarean section. All right. How to diagnose it. It's not easy to diagnose. All right. And what to do with it is even more serious. The chance of the mother dying is high. Yeah, it's high. I came across figures like 12%. The chance of a baby dying in the setting of an abdominal pregnancy is in the 70-80% range. This baby made it. That was why she called it against all odds. Against all odds. So baby made it, but I think I'll leave you to find out from reading what happened to the mother.
Wow. And what about you, Dr. Sanfilippo? Do you have a story that you would like to share?
One of the stories is about the first operation on an abnormal uterus. And this scenario is that a fourth-year OBGYN resident is seeing a patient with the attending doctor. And this patient had gone to Dr. A and B and C, 4 different doctors, and which is not uncommon, and finally comes to the doctor of the day, if you will. And the doctor of the day does something different. Instead of doing a traditional ultrasound at the bedside or in an office, they had a formal ultrasound. And the formal ultrasound says, you have half of a uterus and the other half of the uterus is abnormal. Now, I know you, Dr. Amy, know everything I'm talking about, but for the audience, again, this is a significant abnormality. And for 30 seconds, the way every woman's uterus develops is it comes 2 halves, and then they kind of fuse in the so-called midline. And if they don't fuse properly, we have an abnormality. So to fast forward on this story, the resident with the other attending doctor put in a little incision at the belly button and placed a laparoscope. And again, I know your audience is familiar with what we call minimally invasive, in this case, gynecologic surgery, where from a little belly button incision, we look at all of the reproductive organs. They looked in there, and lo and behold, there was 1/2 of a uterus, and the other half was not as well developed, but it did have a lining. So what they did through this little belly button incision is combine these 2 halves, if you will, of the uterus and make one big uterus. And the patient did quite well following that. But the point of this is, this was the turning point for this resident doctor to say, this is what I want to do. Goes back to your previous question. And to this day, that resident doctor is now a leader in pediatric and adolescent gynecology. And she teaches, she conducts a fellowship, she teaches residents, etc. And she takes care of patients, let's just say from newborns up to 21 years of age, which have these developmental abnormalities, which have some problems with their ovaries, etc. But it in large part stemmed from that one event in the operating room and saying, this is what I want to do. And this is the abnormal situation that I can fix. How exciting is that?
So I want to get to something that Dr. Andrew-Jaja is famous for, and that's your tradition of singing to newborns. What a beautiful way to bring joy to your patients and the families that you've helped. How do you think incorporating joy and human connection can help doctors better support their patients through the highs and lows of treatment?
The connecting patients and helping them get to enjoy the joys of pregnancy and also deal with the challenges of pregnancy, right? So this is something that comes naturally for all of us who have faced pregnancy. It is never straightforward. There is the anxiety that comes with pregnancy at all phases. And as we've told in some of the stories, as pregnancy progresses, you get more confident, but there are new challenges start to occur as well. So there comes a time when all of us in this field of either helping patients to get pregnant and those who are pregnant already, guiding them through and to success, we learn that the patient will not survive this unless they have some emotional regulation. So that's how it comes about. And there is some evidence. I was amazed actually to find how many articles are published out there about what can be done to improve the emotional regulation of pregnant patients and patients undergoing infertility treatment. Um, it's amazing how it can make them feel better. It can make them deal with the anxiety that they experience, and so on. It can yield some good results. One study showed that it increased the rate of success with their fertility treatment. All the same, there are simple things that can be done to improve emotional regulation. We do them all the time, all of us. We exercise, create some endorphins. Some do meditation, some do yoga, acupuncture. I I came to like music. Music has been shown to improve that emotional regulation. Uh, since I love to sing before I got into OBG, so singing became one of the modes that I could use in helping patients cope with the situation. Be it cancer patients, I had it in one of the stories, or maybe in the book. Cancer patients who come and I go to visit them while they're getting their chemotherapy. Do you want me to sing to you? Those I know would say, some would say yes, and we'll share a song together. So I had developed over the years songs for each situation. Holiday period is a great time, to just
Yes.
go crazy and sing other things in the delivery room, and everybody joins us in doing that. So singing comes naturally to me, but using it as a mode is scientifically supported, to my mind, of
Yes.
helping the patient cope with the extreme emotions and there are also, I hear now that there are all kinds of playlists for IVF patients that can be put in there. Let me say though, that when you're doing that, whatever playlists are being developed, the music should not be jarring. It should be something, preferably something the patient is familiar with. Found that if you give the patient a choice to pick their artist that suits them, it is probably better than giving them that rock band to listen to. Sometimes
Right.
it is the words that matter in the music. The lyrics matter. Sometimes it is just the tune, that matter. Something familiar, something soothing, something that is of their choice is better. But there are many choices out there of music that you can use. It doesn't have to be Andrew-Jaja singing all the time.
So, Dr. Sanfilippo, is there anything else you'd like to add? Because before we end the show, I would love for Dr. Andrew-Jaja to sing for us.
Part of this conversation, I think your audience has to have the understanding that their healthcare provider, and I say that meaning their physician assistant, their nurse practitioner, their doctor, are really there for you. And if it's infertility, it's a journey. It's a journey where we're going to go on this together. And we've talked about the hope. Okay, we don't want to be naive about it. And you aptly conveyed patients walk in very discouraged, and it's appropriate. What comes to my mind is unexplained infertility. Well, what does that mean? Why can't I get pregnant? You just told me everything is normal. So what I'm just saying to you is I'm hopeful that the audience takes this book and other books like it and make it an inspiration and try to be cup half full. And I'm a big advocate of being cup half full. And again, medicine has advanced so much. There's so much we can do. So I just wish the best for everyone in your audience.
And I also want to make sure to plug another book that you've written that we've talked about on this show, and that's The Expert Guide to Fertility. So the two books that I think should be companions as you're waiting in the waiting room. I find, the short story book, Everyday Medical Miracles, is really fun. These true stories, really fun to read. But I think fertility patients and their families should be empowered with both of them. I mean, I don't want to put you on the spot, but I'd love for you to sing to us. That would be such a treat.
What a wonderful world.
This particular song is one of my favorites. Let me put it this way. I sing this song when I feel this sense of wonderment, if the word that exists, that of what has just happened the most. The awe. Talk about inspiration. Yes, we're inspired by the beauty of what has just happened. This is the most complex case or the most unexpected, beautiful outcome. Those are the things that make me bring this down. And this one is one everybody knows. And it goes like this. I see trees of green, red roses too. I see them bloom for me and you. And I think to myself, what a wonderful world. What a wonderful world. I see skies of blue and clouds of white, the bright blessed day, the dark sacred night. And I think to myself, what a wonderful world. The colors of that rainbow, so pretty in the sky, are also the faces of people going by. I see friends shaking hands, saying, how do you do? They're really saying, I love you. I hear babies cry. I watch them grow. They'll learn so much more than I'd ever know. And I think to myself, what a wonderful world. Yes, I think to myself, what a wonderful world. Oh, yeah? Oh, yeah.
That. Yay.
Welcome to our wonderful world.
Welcome to our wonderful world. That's
Right.
beautiful. Well, thank you so much for all you've done for your patients, your communities, for students, for everyone's lives that you've touched. And now you're passing on your wisdom through these wonderful books. So thank you to both of you. Anything else you'd like to add?
Yes, I just want people to know where to get this book. Book Baby is the publishing company that we use for the book. Book Baby bookstore. This is it's best to send it. store.bookbaby.com is the short part of it. Then Amazon has it, and so does Barnes and Noble. Every place where books are sold. And I also want to thank the people who cooperated and collaborated with us in writing this book. Co-editor Julie Tractor. You'll see her name on the front cover. She was amazing in the support she gave us. She's the director of midwifery at UPMC McGill Women's Hospital. So they made it all easy for us. I mean, the rest, other acknowledgments are in the book, and I won't go through all of that. So the books like this may not be the evidence-based medicine, but the stories teach all of us some of the things you don't come across in the didactic scientific documentation that we have in many of our journals.
Well, thank you so much for sharing. What a joy what an honor for me to get to spend this time speaking with both of you. Thank you so much. I really appreciate this. Thank you.
The pleasure is mine.
Thank you for the opportunity.
Thank you.
Thank you so much for listening and making the Egg Whisperer Show a part of your weekly routine. To find show notes and a full transcript for this episode, visit dramy.org and look under the blog tab. While you're there, you can find a link for the Egg Whisperer newsletter, which keeps you in the know about fertility news. You can also find Dr. Amy and the Egg Whisperer Show on YouTube, Instagram, or Facebook. If you'd like to learn even more, Dr. Amy offers classes at the Egg Whisperer School, eggwhispererschool.com, or you can request a consultation on dramy.org. Thank you so much for tuning in and for sharing the Egg Whisperer Show with others. Keep sparkling and have a great day.